Hello, hello, welcome. PCOS Wednesdays. Yeah, I'm never ready with the glasses. Hi, good evening. Always busy to clean my glasses. Welcome, everyone. Happy Wednesday. Hi. So anyone as tired as I am? And somehow the weekend was just a few days ago. So we're gonna get started. I think it's about enough of us in here. Welcome and good evening. And my name is Dr. Siobhan Joseph. I am the medical director at Azalea Health Services. And the t-shirt I'm wearing tonight, just felt tired to find anything else to wear. Tonight we're gonna talk about PMS and mood swings and what we can do about them. So most of my talks are centered around polycystic ovarian syndrome, but I'm really addressing everyone and anyone who really could relate to having mood disorders. And this is some important information. So I'm just going to roll through it. But what we're doing is making sure these recordings are available. You guys can watch them later, press pause, and come back to it as well. What we've established is women who suffer with PCOS or polycystic ovarian syndrome are more likely to have mood disorders, specifically depression and anxiety. When compared to women of similar size and ages, PCOS tend to really influence the rate of depression and anxiety in those women. And then significantly, they're also more at risk for eating disorders, which is usually overlooked, and dieting fads are always overlooked as well. But women with polycystic ovarian syndrome will tell you the list of diets they've tried, and that really relates back to eating disorders that are under the umbrella of binge eating disorders and that fast dieting as well too. So that's rolled into the risk of depression and anxiety, as well as just not overall dealing with your weight loss and weight gain challenges as well. So the true recognized definition of PMS is important because it became slang, right? And PMSing, it became something people would use as insults, but it's a true condition and it should be respected as such. So PMS is characterized by the presence of both a physical and a behavioral or non-physical symptom. You must have an overlay of both types. So some women before their periods, it's typical to have physical symptoms, but the non-physical symptoms must be in there as well, and they must occur repetitively. So you can recognize these habits, these behaviors, these moods, and these symptoms cycle after cycle, and they do specify at least 3 cycles in a row this should happen. So this does sometimes impact someone with PCOS. When they're ovulating, they'll have their PMS symptoms and sometimes not even recognize them because it's not something they're used to cycling. But most women, about 80% who do suffer with PMS, know it and have recognized the symptoms as a pattern. The fourth, it's 3 things. 4 things. So physical, and then non-physical symptom must be happening in a repetitive pattern, cycle after cycle, and then it has to interfere with your daily life. So if you're able to cope with your premenstrual and menstrual symptoms, this is not truly officially a diagnosis of PMS until it's at the point where it's impacting your life and interfering with aspects of your life, relationships, work, And then PMDD, so that was PMS. PMDD is everything that happens with PMS rolled into just a more severe mental aspect to it, specifically anger, irritability, and what's described as an internal tension as a prominent symptom. You just feel tightly wound and wired, and all of these symptoms rolled in, ultimately your period arrives. And while you're still on your period, you feel better, you feel lifted from it all. And once you line up, and they would do questionnaires on women, and it's supposed to quiz you guys as to how these symptoms roll out, but it's pretty identifiable. It has to impact your life, has to be repetitive, and your period, once you start flow, the symptoms have completely resolved. And it's usually in just the second half of your cycle. So if you're feeling this way and it's just after a period, then it's more workup needs to be done, or more discussion about other mental health issues you may be having. In terms of interfering with your life, PMS really can impact family and social relationships, and of course work. So a lot of times we can't continue to ignore things that are happening repetitively. And that's a key indicator as to when you should speak with a doctor to see what could be done to improve things for you. The physical symptom, classic key physical symptom is bloating, right? Bloating of the abdomen. The secondary ones with PMS are breast tenderness and headaches. Now, headaches are another night for that, but they're not a primary symptom in PMS, but definitely they're there as well. I'm going to talk about that a little bit as well. And then breast tenderness is just a common physical symptom women may experience, but not necessarily with PMS. And you get very emotional. I could go on. Actually, I found one text that said 150 symptoms were assigned to PMS. The bloating and the physical symptoms, some women have identified joint swelling and pain in their joints before their menses, and hot flashes. That's another one. A little low on the list, but they are comparable to what will happen around menopause. So some women with PMS who hot flash, which really comes on as this internal heat, and also usually with a bit of a dizzy spell. Sometimes for some women you feel a bit off, and it's very random, and you feel hot. So that the menopausal type hot flashes can happen as well too. Okay, welcome to everyone who's joined in tonight. We're discussing PMS, and now I'm going to talk about why does this happen to us? Why should it happen to us? I think someone has a question. I always forget to look down here. But I'll address questions as they come. In the normal menstrual period, the cycle, our estrogen and progesterone are in phase with each other, and these concentrations do affect our what we call neurotransmitters, which are the part of our brain that conducts messages, specifically serotonin, right? So serotonin interacts normally with the hormones our ovaries make, but for some women, and we don't know enough as to identify who, we know there's a genetic part of it that you inherit, but for some women that interaction is off before the period, so your moods are impacted and you're not crazy. This is actually a real thing. It's been studied in animals and in humans. So your serotonin response is abnormal. And this is important to understand because it's as simple as addressing that certain things that you lack. So it's like road with several potholes that you need to fill. So as your period is approaching and you know you have this issue, you definitely could pay attention to this proven deficiency that you may have, which is the serotonin may be low. Serotonin is what is used primarily to treat depression, prescription medications, which are serotonin, selective serotonin reuptake inhibitors. Ignore me, it's a big fancy word for medicines like Paxil and Prozac and Celexa and Zoloft, which are used to treat depression. So for PMS, I'm not saying you need to go on any of these. It's just more important to figure out, well, if serotonin can fix this for me and these moods and this anger, what can I do to take it in? So what foods can boost it? Of course, I'm going to come to nutrition. Tryptophan, which is in salmon, turkey, things that make you feel happy after you eat them. You want to really roll this into your nutrition the week leading up. So if you eat meat, then maybe you do turkey. Eggs, you can get it as well. Nuts and seeds are key. So that 7-day period before you actually start bleeding, when you know your moods are off, you can do that. Pineapples on the list as well, and pineapple always keeps cropping up as something, if you're not allergic like me, something that you should incorporate. But these are foods you would roll into your week just before your period. So to run down the list again, the tryptophan ones are going to really give you a boost of serotonin, which is salmon, a rich source of that, turkey and poultry, nuts and seeds, eggs, and then for the vegetarians, tofu and soy. They say some dairy, but not too much, because you also have to measure things like salt and fats, but milk and cheese and pineapples, right? So that's the nutrition. The other reports that talk about what you might be lacking that's causing your PMS is magnesium. And this was one of the few studies that's actually concrete, where they followed women as they cycle through their months, and they just saw daily levels of magnesium drop until the 2 weeks before the period. And magnesium is key for how you sleep and how you feel and your energy levels. So magnesium, especially if you have insomnia, which some women do suffer with as they enter that PMS zone, they don't sleep well, magnesium is important. So most of the daily supplements will include magnesium in there. You can pay attention to that. You can also just purchase magnesium capsules. Most times when I'm recommending vitamins and supplements, it's important to read the instructions on the dosage. If they say 2 capsules, that's how they've measured that out for the daily intake, and never exceed what's recommended. Magnesium is found in certain foods. So again, leading up to your period, greens, nuts, seeds, always popping up here. Dry beans, whole grains, wheat germ, and oats, right? So you can, drop my pen, you can definitely roll those in leading up to your period as well. Now, moving forward to people who are more at risk for it, if you have pre-existing depression or anxiety, history of suicidal attempts, and every month you're also battling with elements of physical and mood issues, then definitely you would need prescription medication to control that, which would be on an individualized basis. Cigarette smoking does not help with PMS, so if you suffer with a bad mood and you reach for a cigarette, that's actually going to worsen things for you. It's been proven. So we're going to talk more about things you can do to just be in the moment of that mood, that when it's happening, and stick to a plan, especially if it leads to anxiety-driven moments and so forth, right? So when does this start for us? Most women will be experiencing PMS symptoms during their teenage years. It starts as soon as the first period, unfortunately, and many studies show it worsens as we get older. I feel like I'm negative Nancy tonight with this one, but we basically just suffer with it. You do get windows of relief from it if you are pregnant, and also being on a contraceptive, you can get some, I agree, you can get some relief as well. Most women of reproductive age, as I said, will have one or more mild symptoms. It's the severity. And the key factor is it ruins your life for 4 days, and then your period actually comes and you feel better, right? The symptoms such as breast soreness and bloating usually don't cause severe distress, but they do represent like that build up to PMS as well too. In the US, the American Board of Gynecologists decided that they needed a set definition for PMS, because again, it was being thrown all over the place as a symptom and became slang. So they said at least one of the symptoms that I listed before, where there is an associated economic and social dysfunction. You've lost your job, you've lost friends, you have, it disrupts your life, that occurs in the 5 days before your period begins, and has to happen in at least 3 periods back to back, and you are completely resolved of all symptoms for the most part by the beginning of the period, day 1 to 2. So after menopause, you can look forward to relief from this. And again, as I said, if you are suppressing ovulation on a pill or pregnant, you get a little bit of relief, but you trade that up for some other things, right? So basically, I'm going to talk next about the 7 key ways to just manage these mood issues. And what I always try to do when I do these talks is make sure I've done a bit of the back reading, and I've done a bit of the back reading and the studies of worth. So what number 1 is Vitex, which is also known as chasteberry, which is a plant supplement that I've been talking about. When we initiated these Wednesdays, there was a lot of stuff we were doing in Clubhouse, and I'm here now, and I'm going to try to merge a lot of what was said, and we'll go back to Vitex for sure, because it's definitely something to keep on your radar or in your kitchen, in your supplement cabinet, that can help you, and the studies have been rolling out. So I found one from 2013 that showed that the Vitex or chasteberry supplement was very helpful for the physical symptoms associated with your premenstrual syndrome, including the bloating, the breast pain, and the headaches. So just being on the supplement, you would have eliminated in a good way these symptoms, and it worked better than Prozac in this study. And I get excited because I loved how they laid it out, the way I read it, and it's a natural antidepressant from a plant, and who doesn't love that? It is less effective in terms of dosages, so yes, it's going to beat out Prozac in the study if you keep upping the dose of Prozac, but again, the side effect profile really was minimal as well, and that's Vitex. Not necessarily a mood balancer, but if you're not as bloated and your breasts don't hurt and your head it doesn't pound as a signal of your period coming, then you're going to have a better day anyway. So always follow the manufacturer's instructions for the dosing as well too. Of note, what I want to impress when you buy these supplements, anyone who is using supplements that are plant-based that are affecting your hormones, you have to be careful. If you have a personal history of breast cancer, you want to speak with your docs about that, about taking these supplements. And then when on the birth control pill, you definitely would need to stay away from the Vitex in terms of how it might interact with your ovarian function as well. Maybe I'll do a talk about that another time, right? And then obviously if you're on any mental health medications, antipsychotics, antidepressants, don't start supplements without speaking with your specialist. So number 1, Vitex. Number 2, calcium. That's easy. That's going to be quick. Just take calcium. We need it. Your calcium levels change with your cycle. So your calcium level becomes more important. It's just like magnesium. And calcium and magnesium are very similar to each other as well too. So I already talked about magnesium. Just take it for insomnia, for more peaceful sleep and muscle aches and cramps, but the calcium as well is important. And you need more as your cycle pushes on towards the period. It will reduce the bloating, as well as the severe fatigue that some women will suffer from, mood swings, sadness, feeling very emotional, and anxiety. So calcium is important in general for most balanced bodily functions that require calcium, which is every cell in your body. You need about 1,200 milligrams a day. It's safe to take in general if you take calcium supplements. However, it can constipate you, and usually constipation is a sign. I've said this before. That's a sign, a clue. Well, let me back off for a day if you're getting constipated while on iron and calcium and other supplements of this nature. And then obviously if you have other medical conditions, you want to speak with your doc, especially kidney stones. So number 1 is Vitex. Number 2, calcium. I'm going to throw magnesium in the subheading of the calcium as well too. Number 3 on the list is vitamin B6. And before you even purchase these, if you have chickpeas, tuna, salmon, fish in general for B6, potatoes, and generally any kind of that starchy veggie, beef, liver, and organ meats, which is always on the list. And if I wish I could ask show of hands who's eaten liver this week. So most times you probably need to be taking the supplement, right? So that's B6. Some breakfast cereals are fortified with B6 as well. And because the B's are water-soluble vitamins, we don't store them anywhere. You have to get B's in your system daily with your meals and your nutrition as well. Number 4 was to touch on evening primrose oil, which is a plant-based supplement that works with an estrogen-like impact and can be used to, hi, good evening. Money Van Digital, thank you. I appreciate it. So evening primrose oil. Estrogen is important it's a feel-good hormone, right? So during menopause, I prescribe evening primrose oil a lot to help with some of the emotions that my clients go through, the moodiness and the mood swings, the breast discomfort in menopause. So it turns out that yes, it can work for PMS and PMDD symptoms as well. However, because it's estrogen really from a plant and your beginning phase of your cycle, your follicular phase, you're making enough of your own estrogen. You may not want to take evening primrose oil throughout the month, so you have to be wary of that. In the office, I do have moments where we can do a one-on-one, and I can actually have you track your menses, and we can see which are the days that you really flip out on people, and figure out when you may need to supplement estrogen a bit more, so you can balance your cycle that way. and not even needing to be on a birth control pill. But when you take evening primrose oil, you really get that breast discomfort as side effects, heavier periods as side effects, and cramps as side effects. So is it fixing my moods? And here's what it's doing: heavier breast pain or cramps. So the evening primrose oil is on the list, but it's definitely something that's very individualized amongst women who are regular cycles. With PCOS, we roll it in there as needed as well, but women with PCOS tend to have excess estrogen for the most part, or enough estrogen, so adding that in there has to be very specific. All right. You'll see in places with herbs, they talk about St. John's wort for depression and ginkgo biloba for foggy brain. Not enough studies are out there for that. I personally purchased ginkgo maybe years back to help me remember things. I don't know. But it's on, some of the herbs that would help with PMS. But my number 4 was evening primrose. Number 5 are painkillers, but more so anti-inflammatory, so you're not using it for pain. If you're opposed to number 5, that's totally fine with me. But if you are not functioning well because of physical symptoms, you are really going through changes due to inflammation in your body. So you want to stay away from inflammatory producing foods like white sugar and highly processed foods and fried foods, leading up to your period, so you can reduce some of the physical symptoms, specifically breast pain, bloating, and cramps. But some of the discomforts like the joint pain and the joint swelling, that's inflammation. That's kind of working through your system in a bad way. So you want to take an anti-inflammatory right before the period actually starts. So don't wait for bleeding to occur. Definitely keep it simple. Anything over the counter. If you're needing prescription strength painkillers, and we're not talking about PMS here, right? Remember, you're not even bleeding yet. This is leading up to. So we're looking at your woman's Panadol, Ponston Fort, Advil, Aleve, liquid gel. This category of medications, naproxen is Aleve, ibuprofen. This category, they're anti-inflammatories in addition to pain. They cause pain relief by reducing inflammation. So you want to address the situation as early as possible. So if you get stiff joints, headaches, from the first cues that, hey, this has happened in the last 7 periods of my life, then you can reach for one of these a day or 2 before the period gets there. You end up using less of these medications. Always take them with food. You may need at least 2 to 3 intervals of taking it over the course of about 2 days or so, if you're having very severe physical symptoms as well, and you tend to end up having a better period. And typically, if you do this with the anti-inflammatories 2 or 3 months in a row, you're going to skip several months where you didn't need it at all. But definitely, if you've been suffering, don't torture yourself. These are options. So that's number 5. Number 6 is to exercise. And not just exercise, but it's in a combination with just no salt. Challenge yourself. Be as diligent as you can be with salt when you suffer with PMS. And that's exactly what you crave. And I was trying to remember for tonight what the science project we would do, where we took potato and put it in water and put the salt and, the salt pills in the water. Yes, that's exercise. Yeah. Exercise, but also a no salt week maybe is what I would suggest as my number 6, because in the most severe cases of PMS, women gain weight, and that pre-period weight gain can be significant, 3 pounds, 5 pounds. So you're just doing this shift, and a lot of it is water related. Of course, there are other elements you have to be concerned about, especially if you're at risk for high blood pressure, or you have high blood pressure, or you probably need to be checked for high blood pressure. Then your PMS will be worse. The crave of the salt, yeah, it's real. Thank you. Hey, thank you, Stacy. Osmosis. Yeah. So that's exactly what I'm trying to describe. Thank you. It's been a long day. Yeah, but you're precisely right. And by staying away from the water and also exercising, the exercise pushes that water off as well too. So you bloat less and you feel better, and the headache definitely needs to be there. So the women who suffer from that extreme weight loss, if you talk to your gynae and also in conjunction with your medical doctor, you can go on an antidiuretic, which is specific types of blood pressure medication that would help ship that fluid off in the days before your period. But again, that's really individualized, and you would need to see a health professional for that. You would reduce also just, I don't know, everything's going to be better if you stick with that. No, less salt or no salt. And it's so funny, if you start doing it, you start recognizing just how many areas salt enters your life on a daily basis as well. So that's number 6. Rolled into there, you also want to eat small amounts of food when you're PMSing, and more frequent amounts, so you don't have that fullness, bloating situation happening. And then you want to do like complex carbs that take longer to digest, avoid simple, foods that will really break down fast. I'm going to sound hypocritical. I have not been able to do this, but everyone everywhere says abstain from caffeine. If you suffer with PMS while you're having symptoms, you should not take caffeine. And so no caffeine, and alcohol as well. And that's all lumped under that nutrition exercise rule. Right, so the final one, which is number 7, is your anger, right? Your anger. So you really would need to, our tolerance for daily life stress decreases with less sleep. If you're sleep deprived, then you're irritable to begin with. And here I just told you that you could have a gene that's off in your brain where you get your serotonin the same way for 2 weeks leading up to your period. Here I just told you that this is a defined condition, and then life is stressful, right? So you want to make sure you're getting a good night's sleep. If you suffer with PMS, don't play with your sleep. Just call it a night. Get your 8 to 10 hours if you could. And that in itself is a good way to start minimizing your issues with anger, and helps you to manage stress as well. You want to look into meditation, yoga, and just even deep breathing, or take a quick walk. I saw this a few places in the studies that I looked at. Taking a walk can boost your mood. And one of the most important steps in controlling PMS anger, which is a very special type of anger, right? PMS anger comes from nowhere but everywhere. So one of the most important, you can tell that's happened to me before, right? So one of the most important steps is recognizing your physical cues when that version of anger is about to happen, and you need to leave the situation, leave the room if you can, go for a walk, just drink some water, collect yourself as well. Some of the cues: clench your fists, tense shoulders, tense jaws, your heart, you're breathing faster, your heart rate, or you're getting that sweatiness, especially the women who get hot flashes when they are having PMS. You also really would recognize that moment, I hope, if you're going to lean forward to attack. But that's one of the things they listed. Like, one cue is if you lean forward into the situation ready to attack, please walk away. If you are already in a situation where your mind has been like pre-filled with hate or negative thoughts already, and you know that you're in your 3 days of PMS, just stay away. Simple as that, right? But notice these things and just keep them logged in your mind. What you're looking for is patterns that you can recognize and catch easily. And ultimately, if you're out of control and you're starting to have a negative, yes, LOL, exactly, negative impact on relationships, then absolutely therapy. Do not run away from it. PMS, PMDD especially. These are recognized conditions. So it's not okay to make jokes about them if it's not really working for you. It's not okay to accept certain behaviors. It's not okay to allow this condition to not be treated and managed better. Right? So that's it in a nutshell. How did I do? 30 minutes? 30 minutes. And I really want to hear any comments or questions at this time. Or just, how did you feel about the information that was passed on tonight? We will welcome you leaving comments under the post. I'll make sure it's available, and you can review any of these sessions on a Wednesday night. So thank you for your time, everyone. If there are no questions, oh, chocolate, yes, right. Damn, well, bonus number 8, chocolate. Absolutely chocolate. On my wall, I don't want this thing to fall. Yes. Okay, so that's a picture of Lena Horne, and she's been following me around for a little bit where I go. And she died peacefully in her like mid-90s, looking fantastic. She is a mixed race dancer, singer, actress. And her secret, when she was asked how did she eat so well, she passed since a small amount of dark chocolate once a day as a sealer for her appetite, actually, and it works. But when I say dark chocolate, 70% or higher, anything less than that, you're getting a lot of sugar and fats rolled in there. So not chocolate that you're just snatching up by the cashier most times, but dark chocolate, if you're there and you see the chocolates, you want to look for dark chocolate, 70% or higher. It's a natural antioxidant, which just means it kind of gathers up inflammatory factors in your body and sort of helps detoxify. So, and then as an appetite sealant, especially if you don't know when to stop eating, you can eat a small square of dark chocolate, and that bitter chocolate actually has been proven to seal the appetite as well. So yes, chocolate. Thank you for that question, Lexi. Avi says, great info. I started cutting back on the painkillers because of, yes. So side effects, so that I believe was my number 5 was the painkillers, but they're actually anti-inflammatories. The way I said to take them, you're going to use less of them. If you're already day 1, day 2 hell, and your period is severe, then the painkiller will be needed more, and you will strip that stomach lining and have a lot of acid reflux issues as a side effect. The way that I put it on here is a number 5 for PMS. You're actually not taking it when you're bleeding. It's those few days before when you're getting cues of the PMS symptoms in terms of bloating, water retention, joint stiffness and pain, headache, and breast pain, which can be really debilitating for some women. The period pain that requires so many NSAIDs that you get the stomach issue is where we start crossing over to evaluating you for more severe period issues like fibroids and endometriosis, our 2 best friends, right, being sarcastic. But sometimes those painkillers can't touch that type of pain, so you end up relying on them more. I hope I answered your question. Okay, does anyone else have any questions? I see we have some people now joining in, but I think we got to 8:33, 8:34. I'm going to post this, and I hope this was helpful. And you can share it to people who you believe need to know a little more about their PMS. Just be nice about it, especially since you don't know what time of the month they're in. So everyone have a great night and remain safe. Oh, Johnny says, great pain management solutions. Oh, thank you. Thank you. Thank you. Thank you. Absolutely. So everyone have a great night.